Hi everybody, my name is Liz Ash. I'm an ultrasound radiologist here at Brigham and Women's, and we're going to be learning about point of care ultrasound in neonatology today. The first thing we're going to take a look at on the machine are the probes. You want to make sure that you're selecting the correct probe for the patient and the procedure that you're doing. In ultrasound, the probes are defined by the frequency of the sound wave that's coming out of the probe. So in general, the lower frequency waves tend to penetrate further into the patient before they get attenuated, whereas the higher frequency waves don't penetrate as far, but they get more information, they hit more structures along the way, so you get more detail. So the choices here on this machine are a 10 to 22 megahertz probe and an 8 megahertz probe. So the higher frequency, the 10 to 22, you're going to want to use for something like vascular access. And the lower frequency probe is something that you'll want to use if you need to see a deeper structure. So for example, if you're putting an umbilical vein catheter in and you want to look at the inferior vena cava, you might need the lower frequency probe to get a better look at that. The other way we define the probes is by the footprint. So you can see the shape of this probe is flat, it's linear. So this is a high frequency linear probe, and it says here on the probe L 10 to 22. So that means linear 10 to 22 megahertz. This one is a curved footprint, and it says 8C, which means 8 megahertz curved. And that just means that you're going to get a wider field of view with the curved probe, because instead of having a rectangular footprint, it's going to have more of a triangular footprint. And that's important when you're looking at deeper structures. The other thing you need to know about the probes is all of the probes have something that you can feel on one side. It's usually a little notch or a line. So I don't know if you can see that you can feel. And this one just has just a little bump here that you can feel. That is the side of the probe where your thumb goes. You hold it kind of like a pen, and your other fingers go on the other side of the probe, and you should be holding it firmly. So if you get dainty about it, you're not going to have good contact with the skin. And air blocks ultrasound. So we have to do everything we can to get the footprint of the probe as close as possible to the target that you want to image, and we have to get all of the air out of the way. So that means that you need to hold the probe firmly, press firmly on the patient, and use a lot of gel in between the probe and the skin surface to clear that air. But your thumb will always go on the side with that palpable bump, line, notch, depends on the probe. And that side of the probe corresponds to, can you see what I'm pointing to here on the screen? So there's a little GE venue up in the corner of this image. It's like a yellow font. It's right here. It doesn't matter what manufacturer you're using, but there's some indicator here that tells you that that is the side of the probe that has the notch. And if you're not sure, if you have the correct probe, select it. So right now we're using the linear 10 to 22 because it says that right here on the machine. Can everybody see that? So that's what we've selected. So you just press what you want. You pick the setting that you like. So we're going to do venous access. So we'll press vein. And then your probe is on when you see these white lines. And then if you're not sure which side is which, do you see when I press on the side with the notch? You can see the change on the side with the text. Does everybody see that? When I press on the side that doesn't have the notch, the change is on this side. So that's how you figure out which way to hold the probe. And you want to make sure, this sounds like it shouldn't matter. It sounds like when you put the probe down, you're looking at what you're looking at, and it doesn't matter. But it does matter. First of all, because anybody looking at the screen while you're scanning needs to be able to tell what you're doing, because sometimes it may be one person's holding the probe and someone else is holding the needle. So you want to adhere to this convention because it's really important for safety. The other reason is because you want to be able to know which way you're moving, and we were just talking about this offline before we started, but this is like driving a car. It's almost like driving a stick shift. You have to just do it a lot and get comfortable with it, so you're not thinking about, well, my thumb goes on this side and the probe faces this way, and if I move this way, the image goes that way. You don't want to be doing the mental gymnastics. You want to just get comfortable with it. So the key here is that the side that has your thumb is always either facing to the patient's right or the patient's head. So that by convention, the images are displayed in such a way that the side with the text on it is either the patient's right if you're taking a transverse image, or it's the patient's head if you're taking a sagittal image. And you just stick to that. The other thing that's really important, and we're going to practice that, is that you label the images. Because it turns out that with ultrasound, you could be imaging a vein in an arm, or you could be imaging a vein in the leg, and they will look exactly the same. So if anybody wants to go back and review the images, and that will happen for a variety of reasons, you want to make sure that they're labeled. So you're just going to put right brachial vein or left femoral vein, whatever you're doing. Just make sure that it's labeled. Okay. Any questions so far about that?